The fish oil capsule you swallowed this morning may have done almost nothing for you. And if it left a fishy taste creeping back up an hour later, that is not just an unpleasant quirk. It can be a warning that the oil inside went bad before it ever reached your bloodstream. I am Dr. Hale. In my 15 years in internal medicine, I have had more patients than I can count pull a big bottle of fish oil out of their bag, proud that they take it every day for their heart and their brain, and have no idea that the pill is doing a fraction of what they think. They did the responsible thing. They heard omega-3 is good for you. They bought the biggest bottle on the shelf, and a lot of them are getting almost none of the benefit because of a handful of details that nobody ever told them. This matters whether you are 45 or 75 because the fats we are talking about touch your heart, your blood vessels, and your brain, and the need for them does not wait for old age. So today I am going to show you why plant sources of omega-3 are not the same as the fish kind, why the form in your bottle changes how much you actually absorb, how to tell if your fish oil has quietly gone rancid, and the one simple change at mealtime that can nearly double what your body takes in. And near the end I will tell you who should talk to a doctor before taking these at all, because more is not always safer. Stay with me. Let me start with what omega-3 even is, because the word gets thrown around like it is one single thing. It is not. According to the National Institutes of Health, Office of Dietary Supplements, most of the research focuses on 3 omega-3 fats. There is ALA, which comes from plants like flaxseed, chia, and walnuts. And there are 2 long-chain ones, EPA and DHA, which come mainly from fish and seafood. All 3 are omega-3. But your body uses the fish kinds, EPA and DHA, for most of the heart and brain work that made omega-3 famous in the first place. Here is the trap that catches so many people, especially those trying to get their omega-3 from plants. Your body can turn a little of the plant kind, ALA, into the fish kinds, EPA and DHA, but only a little. The Office of Dietary Supplements notes that in adults only a small percentage of ALA converts to EPA, and even less makes it all the way to DHA. Picture trying to fill a swimming pool through a coffee straw. Yes, water goes through. But almost nothing arrives compared to what you poured in. That is why the Office of Dietary Supplements says that getting EPA and DHA directly from food or supplements is really the only practical way to raise the levels of those fats in your body. So if you have been sprinkling flaxseed on your oatmeal and assuming you have your omega-3 covered, I have to be honest with you, flax is a fine food. But for the fish type of omega-3 that your heart and brain lean on, plant ALA is a trickle, not a stream. This is not a reason to stop eating those foods. It is a reason to stop counting on them for the job that only fish and seafood, or a real fish oil, can do well. And it is worth a moment on why your body wants these 2 fats so badly, because it makes the rest matter more. DHA is a major building block of your brain and of the retina at the back of your eye, woven right into the structure of those tissues. Both EPA and DHA are used throughout your heart and blood vessels, and one of their clearest, best measured effects is helping to lower high triglycerides, that fat in the blood we worry about as the years add up. The Office of Dietary Supplements describes omega-3s as components your body uses in the membranes of every cell, not just a passing nutrient. So this is not a fad. It is a fat your body is literally built out of, which is exactly why it is worth getting right instead of getting fooled. Which brings us to the fish itself, and the simplest answer of all. Before we even talk about a single capsule, the American Heart Association recommends eating fish, especially oily fish, about twice a week. We are talking salmon, mackerel, sardines, herring, lake trout, and albacore tuna. A serving is around 3 to 3.5 ounces, roughly the size of your palm. 2 of those servings a week land most people close to the omega-3 intake the research points to, without a single pill. So the first honest thing I want you to hear is that a supplement is a backup plan. Real fish on your plate is plan A. If you are already eating oily fish twice a week, you may not need the bottle at all. Let me put some realistic numbers on this, because dosing is where people either panic or overdo it. The American Heart Association describes 1 serving of oily fish a week as providing roughly 250 milligrams a day of the combined fish omega-3s, EPA and DHA, which is a sensible target for a general healthy adult. For people who already have heart disease, the Heart Association has pointed to about 1 gram a day of EPA and DHA, preferably from fish, as a reasonable amount, and that is a conversation to have with your own doctor rather than a number to chase on your own. What I want you to take from this is simple. The useful dose is measured in the actual EPA and DHA, not in the big total fish oil number on the front of the bottle. And bigger is not automatically better, because very high doses carry their own cautions, which I will come back to at the end. But many of you do not love fish, or cannot get good fish where you live, and for you a supplement is reasonable. So let us make sure yours is actually working. And this is where it falls apart for most people. If this is already changing how you think about that bottle in your cabinet, do me a quick favor. Subscribe to Dr. Hale, and tell me in the comments how old you are, because the ages of the people watching genuinely shape which topics I cover next. Alright, back to it, because now I want to save you from 3 mistakes that quietly waste your money. Mistake number 1 is taking it on an empty stomach. Omega-3 fats are, as the name suggests, fats, and fat needs company to be absorbed well. Think of these fats like a passenger with no car. On an empty stomach, that passenger is standing at the curb, and a lot of your omega-3 never gets a ride into your bloodstream. Now give it a meal that actually contains some fat, and suddenly a car pulls up. The research on this is consistent. Taking omega-3 with a meal that has some fat in it can raise how much you absorb by a large margin compared with taking it on an empty stomach or with a fat-free meal. So the fix costs you nothing. Do not take your fish oil with black coffee and a dry piece of toast. Take it with a real meal that has some fat in it. Eggs, avocado, olive oil, nuts, or the fish itself. Same pill. Much more of it actually lands where you want it. Mistake number 2 is the form, and this is one almost nobody knows to ask about. Fish oil comes in a couple of chemical forms. One is closer to the natural form that fat takes in actual fish, often labeled triglyceride form. The other is a processed form called ethyl ester, which is common because it is cheaper to make and can be concentrated. The natural, triglyceride form tends to absorb somewhat better, and it also tends to be more stable, meaning it is less likely to go bad on the shelf. You do not need to become a chemist about this, but if you take fish oil regularly, it is worth turning the bottle around and looking for the word triglyceride, or asking the pharmacist, because the cheaper form can absorb less and spoil faster. And spoiling brings us to mistake number 3. The one that genuinely surprised even me early in my career. Fish oil can go rancid. These fats are delicate. The very thing that makes them special, the way they bend and flex in your cells, also makes them easy to damage by heat, light, and air. When that happens, the oil oxidizes. Think of a cut apple turning brown on the counter, or cooking oil that has sat open too long and smells sharp and off. The same thing happens quietly inside a capsule. And here is the honest problem. An oxidized fish oil is not just weaker, it brings its own load of damaged, oxidized fats into your body, which is the opposite of what you were hoping for. So how do you tell? Your nose and your gut are the test. Bite into a capsule. A fresh one should smell clean and mildly of the ocean. If it smells strongly rotten, sharp, or paint-like, That oil has turned, and that fishy taste that repeats on you an hour after you swallow it, the one people joke about, can be a clue too. A mild fishy note can just be the oil, but a strong, rotten, repeating fish taste often means the oil was already oxidized going in. That is your body telling you something. So store your fish oil somewhere cool and dark, not on a sunny windowsill or above the stove. Some people even keep it in the fridge. And do not buy a bottle so enormous it will sit half-used for a year turning stale. Let me put a face on all of this, because it makes the pieces stick. I will call him Walt, a composite of many people I have seen, 58 years old. Diligent. He had taken a giant, bargain bottle of fish oil every morning for years, on an empty stomach with his coffee, kept right next to the stove where it was warm. 2 tiny capsules a day, the cheapest on the shelf, in the processed form, probably half oxidized. He was doing everything he thought he was supposed to, and getting almost nothing for it. We did not add some exotic product. We had him eat salmon or sardines twice a week, and on the other days take a fresher, better stored fish oil in the natural form, with a meal that had fat in it. Same effort, roughly the same cost. Completely different amount actually reaching him. Now let me be the honest voice here, because this channel is built on it. Omega-3 from fish is one of the better supported nutrition stories we have for the heart, and that is exactly why the American Heart Association points people toward oily fish. But I am not going to tell you a fish oil capsule is a miracle. Large studies on high-dose fish oil supplements have been genuinely mixed, and for a healthy person with no particular risk, a pill is not guaranteed to change your future. What I am telling you is narrower and more honest. If you are going to take fish oil, do not waste it. Do not let a bad form, an empty stomach, and a rancid bottle turn a reasonable habit into an expensive one that does nothing. And do not assume any cheap capsule off the shelf is doing the job, because a lot of them are not. So here is exactly what to do this week. 1. Aim for real fish first. 2 servings of oily fish a week, salmon, sardines, mackerel, herring, or trout, does more than any pill and covers most people. If you take a supplement, take it with a meal that contains fat, never on an empty stomach. That one change alone can sharply raise how much you absorb. 3. Turn your bottle around and look at the form. Favor the natural triglyceride form when you can, and check the amounts of EPA and DHA on the label rather than just the total fish oil number, because those two are what actually do the work. 4. Do the freshness test. If a capsule smells strongly rotten or gives you harsh, repeating fishy burps, retire that bottle. Store fish oil cool and dark, and buy a size you will finish in a few months, not a year. Now the part I never skip, because it matters. Everything here is education, not a prescription, and it is not a substitute for your own doctor. Omega-3 fats can gently thin the blood, so if you take a blood thinner, aspirin daily, or you have a bleeding disorder, or you have surgery coming up, talk to your doctor before taking fish oil, especially at higher doses. There has also been a signal that very high doses may raise the risk of a certain irregular heartbeat in some people, which is one more reason not to megadose on your own just because a little is good. And if you ever notice unusual bruising or bleeding, a racing or fluttering heartbeat, or chest pain, that is not a supplement question. That is a call to your doctor, and some of it is a call today. Here is the thread I want to leave you with. Today was about one nutrient hiding in a bottle that most people are getting wrong. But your body is quietly asking for a whole handful of nutrients, and when it runs low on one of them, it does not always send a lab result. Sometimes it sends a crack at the corner of your mouth, a strange tingling in your fingers, or gums that bleed when you brush. In my next video, I am going to walk you through 9 visible signs that your body may be low on a key vitamin or mineral, The clues most people blame on age and completely miss. Subscribe so it reaches you. Whether you are 45 or 75, you are never too early and never too late to make the good habits you already have actually count. And the version of you 10 years from now will be grateful you stopped throwing money at a bottle and started getting the real thing. I am Dr. Hale. Take care of yourself.